This doctor wants to prescribe a cure for homelessness. So I have to actually read this part of my grant writing class. Um, I figured I would share it. So, over the last decade, cities up and down the West Coast have seen a tsunami of homelessness flood their streets. Encampments dot freeway underpasses, parks, city downtowns. Distressed people languish on street corners and sidewalks. Cities, big and small, must grapple with what to do about it. The most recent count by the federal government found that more than 200,000 people experienced homelessness in California, Oregon, and Washington in 2022. The growing crisis has become a pressing political concern for voters and politicians. The new mayor of Los Angeles and new governor of Oregon, for example, each declared homelessness a state of emergency on their first day in office. The governor of California has similarly made fighting homelessness a top priority. Excuse me. Living in California, I found the intractable homeless crisis to be heartbreaking and infuriating, and I've been inspired by public servants who are working to find solutions to the problem, which is why I've been closely following the career of a former classmate of mine. His name is Andrew Bozzari, and he's primary care physician in Toronto who has become something of a rock star in healthcare. He serves as an executive director of the Gutso Center of Social Medicine and the University Health Network, the largest research hospital in Canada. Bozzari and his hospital have been doing innovative work to help people experiencing homelessness, including the launch of an exciting new project to build and provide permanent housing for the most vulnerable. It's part of a broader movement of hospitals, both in Canada and the United States, to improve health care outcomes for homeless patients by providing them with what might be considered the ultimate in preventative care, the stability and dignity that comes with having a permanent home. The policy obviously benefits those struggling on the streets, but it also helps hospitals cut the massive costs of caring for homeless patients who frequent their emergency rooms. With the project slated for completion this year, Bozzari will soon be able to essentially write a prescription for housing to those who need it most. A prescription more powerful than pills. As his job title makes clear, Bozzari is a practitioner of social medicine, is a field that sees individual health as more than simply a function of our diet, exercise routine, genetics, and so on. It recognizes that our health is intractably linked to our social and economic condition. The air you breathe, the job you have, the income, and the social connections you have are a much larger driver of health outcomes than how many primary care visits or surgeries you get access to as a patient. The social and economic determinants of health are devastatingly clear for the homeless population. The life expectancy for people surviving homelessness is half that of the general public. Bozzari says that's clear both in U.S. and Canada data. So this is a terminal condition, and so this is a morally imperative, but also an issue where we need to be clear about the cruelty we are imposing on the status quo. There are many factors that can contribute to people living on the streets: poverty, childhood trauma, mental health issues, drug abuse, bad choices. But study after study find a central factor behind the growing crisis is pretty simple: a lack of affordable housing. Economists at Zillow, for example, found that when the typical resident of a city must spend more than a third of their income on rent, homelessness begins to skyrocket. Another study conducted recently by researchers at Stanford University finds that the explosion of homelessness in California over the last decade can be largely explained by the growing housing affordability crisis in the state. High housing costs and a low stock of affordable housing create a precarious situation, especially for lower income families and individuals who are at higher risk of becoming homeless, the researchers write. Researchers compare the effects of housing scarcity on homelessness to a game of musical chairs. When housing becomes scarce, high-income folks end up living in spots that end up to be reserved for middle-income folks. Middle-income folks start inhabiting formerly low-income units, and the most vulnerable low-income folks are pushed out onto the street. It's why advocates like Bozari call for a housing-first approach to ending homelessness. Housing those who need it, Bozari says, is a necessary first step of providing people with the stability needed to solve other problems that may have resulted in them becoming homeless in the first place. But of course, building affordable housing is easier said than done. It costs lots of money, and at the local level, homeowners show a propensity to fight tooth and nail against developmental projects that might bring low-income residents into their neighborhoods. Last year, for example, a proposal to convert a hotel into homeless housing in San Francisco's Japantown was shot down after fierce protesters by residents of the neighborhood. Our neighbors to the north, with their universal healthcare system and friendly disposition, may have a reputation for greater government support for those in need, but Bozari says Toronto also has a serious problem with high levels of homelessness. And like here, NIMBYism and lack of adequate taxpayer support have posed a challenge to tackling the issue. True, Toronto has more extensive shelter system than many cities here, especially on the West Coast. But Bozari hardly sees shelters as the solution to the problem. Bozari says Toronto's homeless population now numbers nearly 10,000 people. The city's shelters are overflowing and their public housing has multi-year waiting lists. More importantly, he says, at best, shelters and other forms of short-term housing are only a temporary fix unless we actually address the pathologies of poverty. Within proven treatments like housing for all, the crisis will only compound in the coming years, Bozari says. As a doctor, Bozari has come face to face with the health challenges of the homeless population. He and his colleagues have spent years feeling the frustration of prescribing things that we know aren't going to work, and knowing with a high degree of precision who's at high risk of being back in the hospital in 10 to 20 days. Bozari says, it's the person who has no fixed address, who doesn't know where they're going, who is leaving with some plastic shopping bags versus someone who is being picked up by family members or an Uber. Which is why Bozari and his hospital partnered with their city government and the United Way of Greater Toronto to build a new 4-story building on hospital land to provide permanent housing to those grappling with homelessness. This multi-million-dollar project, scheduled to open this summer, is essentially a form of public housing where doctors are triaging and identifying who most needs a home. The first phase of this new program, he says, will amount to more than 50 units that will provide people with their own bathroom, kitchen, and bed. Bozari hopes to see the program scale and dramatically reduce the number of homeless people. Bozari says it's not only a matter of social justice, but sound economics. It could cost about $30,000 or more to have a patient on a hospital ward for a month, or nearly $7,000 to be in a sheltering system for the months versus $2,500 and $2,800 per month for supportive housing. Other hospitals in the United States that are getting into the housing business have come to a similar conclusion. Many hospitals realize it's cheaper to provide a month of housing than to keep patients for a single night. While other hospitals have focused on providing temporary housing to homeless people, University Health Network is focusing on making permanent units. In addition to the program aimed at providing permanent housing to homeless people, Bozari's hospital also funded a program that provided food boxes to them during the depths of the pandemic economic downturn. I, in my medical training, never thought that I would be prescribing food or housing. This should not be the case, but that's the desperate state of the poverty we're in. What would you have done? What would you have us do as health workers? Bozari is quick to point out that the program his hospital is pursuing won't alone solve the problems of homelessness in Toronto, but he hopes his program will prove effective and scalable. At the end of the day, Buzari says, only politically will and large public investments in housing and community social work will end the homeless crisis. I think I'm going to stop there. So that's it for this article. It's a neat idea. I kind of wish we could do something, but this is definitely one idea of trying to help with homelessness. And honestly, the title is amazing and fits perfectly.